Good morning, ladies and gentlemen. First of all, thank you for the Japan Society for Occupational Health to give me opportunity to present in the 93 Annual Conference for International Session. My name is Indri. I came from Department Occupational Health and Safety, Faculty of Public Health, Universitas Indonesia. I will present my research about risk factor of sociodemography and work environment that related to the musculoskeletal symptom among small-medium enterprise worker in Vietnam. Based on the data from Asian Economic Community on 2015, in Asian country is about 95% enterprise is categorized as SME. SME provide until 90% working opportunity for the citizen. In Vietnam, the number of SME is 500,000 company. The impact of the SME growth is also increasing number of employee as well. However, due to the limited resources and technical capacity in the SME, so the SME more prone for the occupational health hazards and risks, particularly for the low back pain. Low back pain is related issue with the musculoskeletal disorder. In Vietnam, 80% women worker in seafood industry had been experienced for MSD symptom. MSD is mean the musculoskeletal disorder symptom, especially in their hip, neck, and shoulder. And for the nurse in Vietnam, is about 74%. They also have experienced MSD mainly in the lower back and necks. So it means poor working environment and MSD have been associated with the decrease of work ability. Because of that, the objective of my research would like to determine the socio-demographic and work environmental risk factor related to the musculoskeletal symptom among SME workers in Vietnam, particularly for the food processing and garment industry. The sample, we estimate the sample size is 500 workers, half from the small industry and half from the medium industry. We also add 10% to anticipate the potential incomplete data, but after cleaning, we collect 530 samples from the garment industry, 281 samples, and from food processing, we collect 289 samples. The instrument, we use two kind of instrument, both of them is questionnaire. The first is self-devised sociodemographic questionnaire, is to collect about the lifestyle and about the occupational health safety matter, and the second is the standardized Nordic questionnaire, is to collect about the musculoskeletal symptom. For acute, it means the last 7 days, and for the chronic symptom, it means the last 12 months. This is the results for sociodemography of the respondent. Female worker mostly with the highest percentage than the male, and they had graduate from the junior high school as the highest percentage. They have single, and also mostly they already as the permanent status, and also they get the shift work. And for the lifestyle, because the female worker is found mostly they have no smoking habit and have no alcohol consumption, and also they have good physical exercise. They also have enough time for the sleep, because mostly 57% they have 8 hours for sleep duration. But for the chronic and acute MSD, they feel yes, have chronic and acute MSD mostly equal, because the percentage is around 40 until 50%. And this is the distribution of the MSD symptom. Both for acute symptom and chronic symptom, they felt uncomfort in their shoulder, in the left and right shoulder. So it's almost same. This is the result of environmental condition. The environmental condition such as noise, glare, lack of lighting, hot and humidity, cold temperature, they feel there is no problem. They feel it's not frequent they have such as environmental hazard condition in their workplace. However, for the posture, they sit repeatedly, they have to use hand and finger in unnatural posture when they walk, and also they have mostly sitting on the chair without body movement. The posture, because this is SME, some of the worker also sitting on the floor without body movement, and also squatting posture and standing posture. And how about the floor? There is a slippery floor also, and this is the table correlation of risk factor with musculoskeletal symptom. For the OR analysis, we can found there is a significant, so it means the permanent they have 3 and 4 times to get chronic MSD and acute MSD than the non-permanent worker. And if the worker have shift work, they also have around twice times they get chronic and acute MSD than the worker who have no shift work. The longer duration to when they go to the work is also twice time to get MSD and to get chronic and acute MSD than the short duration to the work. For the environmental hazards, we found noise, glare, hot, humid is also have correlation significant to the MSD. For chronic and for acute, you can see from the table. And for the work posture, we found the manual handling both, and for work posture, we found for manual handling there is a significant correlation for both chronic and acute musculoskeletal symptom. Also, mostly sitting off the floor without body movement, if they get this bad posture, so it means they will get 2.5 times to get musculoskeletal symptom than the worker who not did this bad posture. Mostly squatting posture, standing posture is also have a significant correlation with the musculoskeletal symptom. Is also the slippery floor. You can see the slippery floor have twice for the worker to feel the musculoskeletal symptom than the floor not slippery. So we can found there is some variable from the sociodemography and environmental hazard that's related significantly with the musculoskeletal symptom. There is an employee status, shift work, trip duration, go to the work. For the environmental, there is a noise, heat, and humidity, slippery floors. And for the work posture, there is also sitting and standing, and also manual handling. So as the conclusion, SME, small medium enterprise, should control environmental hazards, especially for the slippery floors, noise, glare, heat, and humidity in their workstation. And they have to improve the work activity, such as to reorganize the shift work and also minimize the manual handling and bad posture for a long time. So it could be minimize the symptom and uncomfort of the musculoskeletal among the worker. This is the reference that I use, and I also declare there is no conflict of interest for my research. Thank you for watching my presentation. If you have any question, so you can send me email. Thank you so much for your kind. Okay, see you.